Hi, I'm David, and today we're going to do a lumbar spine examination. This is Ben. He's kindly volunteered to be our patient. So first thing, it's important to adequately expose the patient. So ideally taking the top off, and our first part of the examination will be inspection. So first of all, we have a look from the side. So Ben, if you just don't mind turning towards that there. I'm looking for the normal cervical lordosis, thoracic kyphosis and lumbar lordosis there as well. It looks good, okay. And do you mind just turning towards there? Good, okay, so now we can have a look at the back to see if there's any abnormalities, so any swelling, erythema, scarring, any wasting at all, or any abnormal areas of hair growth. That seems normal. So after inspection we can go on to feel. So Ben, do you have any pain in the back at all?
Not normally, no.
Okay. So first of all I'm going to have a look at palpating the spine's processes. Starting from the neck. Tell me if you've got any pain here at all. So look for any tenderness, look for any steps in the spine's processes as well. And that could suggest spondylolisthesis. Any pain here?
No pain.
Good. And if you go all the way down to the lumbar spine and the sacrum?
No.
Good. Okay. After feeling of the spine's processes, we then go on to the paraspinal areas. Tell me if you've got any pain here?
No.
Okay, so we're looking for any tenderness and also assessing muscle tone. And that's okay, is it?
That's fine, yeah.
Good, okay. After that we can go on to palpate the greater trochanters, the glutes and the ischial tuberosities if indicated. So I'll just have a feel of the greater trochanters here. Any pain there at all?
No pain.
Nothing, okay. Right, in this instance I won't have a feel of the glutes and the ischial tuberosities, but we could do it if indicated. Right, after having a feel we then go on to movement. So first of all we'll assess flexion. So Ben, if you just keep your legs straight and keep facing that way, and just bend over for me. That's excellent, good, and come back. And any pain there?
No pain.
Okay, so pain and flexion could indicate abnormality of the discs. And now if you lean backwards for me, don't worry, I'll catch you if you fall. That's okay, and any pain there?
No pain.
Okay, pain there could suggest abnormality with the facet joints, spinal stenosis, or nerve root compression. Okay, after that we can go on to assess rotation. So keep your legs straight again and just twist around for me. That's good, and to the other side. Excellent, okay. And there's good range of movement there. Any pain?
No pain.
Great, and then we can finish off with lateral flexion. So again, keep your legs straight and just slide down. Good, to the right, excellent. And to the left. Good, and any pain there?
No.
Okay, that's great. So after movement, we can finish off with special tests, but just before going to that, I'd like to assess the joint below the lumbar spine, which is the hip. So we've assessed really the thoracic spine here, so now we can go on to the hip. Ben, if you don't mind just having a seat on the couch, and just lie down with me as well. Good, okay. Alright, so this is just going to be a very quick examination. I'll just take the weight of your leg, Ben, and we'll just assess movements. Ideally you do active and passive movements, okay, but this time we'll just do passive. Tell me if you've got any pain here, so flexion,
No pain.
extension, go abductions there, so just straighten your leg out for me, good. Any pain there? No. Good. And adduction, any pain?
No pain.
Okay, I'm just going to bend your knee slightly. Any pain there?
No.
The internal rotation. Pain there?
No.
Excellent rotation. Okay, so we do the same on the other leg, but for the purpose of this examination, we'll just concentrate on the right side. So there's good range of movement there, and we've already assessed tenderness. We also have a look at the area to make sure there's no erythema or anything like that. So after movement, we can then go on to assess the neurological status. This is quite important when assessing the lumbar spine. So we need to assess for tone, power, sensation. So I'll just assess for tone to begin with. So I'm just going to shake the leg a bit like that. It's normal tone. Okay, it's normal tone there. We can then go on to assess for sensations. So then, if you close your eyes for me, I'm going to be touching you on different parts of your legs, and I want you to say yes when you think I'm touching you. Okay.
Yes. Yes.
Good. So that's assessing L2.
Yes. Yes.
So medial aspect of the knee, that's assessing L3.
Yes. Yes.
L4.
Yes. Yes.
L5, and then lateral aspect.
Yeah.
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 That's good. Excellent. So normal sensation. You can open your eyes now. We'll assess power. So if you just bend this knee, good, and just lift your leg up like that, good, and stop you pressing it down. Good. So that's flexion of hip. That's assessing L2. Good power there. And try and straighten your leg out now. Good. That's extension. So that's L3. And with this ankle, can you just lift it up like that for me? Good. Stop you from pressing it down. Good. That's L4. And like same thing again now, just with your big toe. Just raise it up to the ceiling. Good. That's L5. And just press my hand down towards the sofa now. Good. That's S1. Well, that's good power there. So we do the same on the other leg as well in real patients. If you don't mind getting up on your feet now. Another way to assess L4 and S1 is to ask the patient to walk on the heel. So Ben, can you go like that for me? Excellent. So that's L4. That's great. And now S1. So go on your tiptoes and walk on your tiptoes. That's good. So good power S1. Great. Okay, so now we can go on to special test of the spine. So if you don't mind just facing there, Ben. So first of all, we can start with Schober's test, which assesses the mobility of the spine. So we locate the posterior superior iliac spine, okay, which is here. And then we make a 5 centimeter mark below, which I've already done, and a 10 centimeter back above that point, which is around about here. Just get my tape measure. We then ask the patient to flex. So Ben, if you just keep your legs straight and just bend over. Good, as far as you can. Keep going, keep going. Good, so in a normal patient, that gap should be more than 20 centimeters, and it is in Ben, it's 21 centimeters. If it was less than 20 centimeters, it would suggest some abnormalities such as ankylosing spondylitis, and if you can come back like that. Good, so that's Schober's test. Right. Next we can perform the Stork test, which assesses for any abnormality of the sacroiliac joint. So if you put your arms across your chest like that, good, okay, and then can you just stand on one leg for me? Good, and just lean backwards towards me. Good, okay, any pain in the back there or the bottom?
Yeah, no pain.
Okay, good, that's okay. So pain around the sacroiliac, it would suggest abnormality of the sacroiliac joint, but there's no pain there, and you perform it the same on the other leg as well. So after the Stork test, we can then do something called a Trendelenburg test. So I'd like you just to put your hands on your hips like that. Okay, and again just stand on one leg. Okay, so the hips remain stable, that's good, so you can relax now. If there's any abnormality, so if the hip was dropping down, that would suggest an abnormality on the other side, so the supporting leg, due to weakness of the gluteus medius or any painful disorder. So that's Trendelenburg test. If we carry on with the special test now, we can ask you to lie on the sofa again then. And if you just lie on your back. Okay. Right, so we can assess the straight leg raise test, which can identify abnormality with the sciatic nerve. So with this leg, keep it straight and just lift it up. Got any pain there?
Yeah, no pain.
Great, okay. So if a patient does have pain, you can just lower it down a bit and then just dorsiflex the ankle, which it is again, and that could reproduce the pain. Any pain there?
Yeah, no pain. No.
That's good, okay. And if a patient does complain of pain, you can bend the knee to ease the stretching on the sciatic nerve. There's no pain there. Okay. if you do that, the same thing again, just keep that leg straight, lift it up. Okay, that's good. Any pain on the left side or your back at all?
No pain.
Good, okay. So pain on the contralateral side when doing the straight leg raise test could suggest a big disc herniation in the lumbar spine, but there's no abnormality there. Another test we can do is something called Faber's test, which assesses for sacroiliac joint disorder again. So then if you just bend this knee and put this foot onto that knee, good, and let your leg flop out like that. Okay. And we place one hand on the contralateral ACES and then one hand on Ben's knee here. I'm going to press down. Tell me if you've got any pain in the back, okay, or any buttocks still.
No.
Any pain there? Okay. So pain in the sacroiliac area would suggest abnormality of the sacroiliac joint again. Now then, if you can lie on your front, you can also do something called femoral nerve stretch test. So if you bend this knee up like that, good. Now we're just going to take the weight of your knee here. Just raise your knee up like that, okay. Have you got any pain anywhere?
No pain. No.
Okay, good. So a positive test here would be pain on the anterior thigh because of stretching of the L3, L4 nerve roots. This is, that would be uncommon because disc herniations usually occur at L5 to S1. That's great. That concludes the test of the lumbar spine. Thanks very much, Ben. That's it.